many of your patients spend their days scrolling, texting, clicking on their mouse, or typing all day long on their keyboard because they work in an office? Many of them, right? And then they come into your clinic with wrist pain, tingling, pain, numbness. We are here to help. So today, I am going to share with you my best TCM and acupuncture protocol when it comes to carpal tunnel syndrome. And then I'm going to share a story of a friend of mine who used acupuncture instead of following her doctor's advice to get surgery. And guess what? The acupuncture rocked it. You knew that anyway, right? Today, we're going to look at all the TCM tools we have at our fingertips in order to help our patients with carpal tunnel syndrome. We're going to look at the root cause, what are the main patterns, how we address the branch and the root, distal point, local point, ear acupuncture, moxa, cupping, and even herbal treatment and supplements. Are you ready? Let's do this. Welcome back to my channel. If it's your first time here, I'm Clara from AcuPro Academy, and I create Chinese medicine and acupuncture content for students and practitioners, making it easy to grasp and fun to learn. Let's start with a personal story of one of my dear friends who was a librarian at the Vancouver Public Library for many years. And when I was in TCM school, she was diagnosed with carpal tunnel syndrome because she was shelving books, putting them back up with her right hand all the time. And some of those books are really heavy, and all day long she would shelve the books. So she would use her wrist back and forth in the same repetitive motion. She got worse and worse and worse to the point where she wore a brace. And eventually her doctor was like, I think the only thing we can do now for you is surgery. I remember her pain was really bad. And not only that, but her grip got weaker and weaker. So she couldn't even carry the books. And she had to use her left hand, which started to hurt as well. So that wasn't helping anybody. And because I was in school at the time, I said to her, why don't you try acupuncture and see what happens? Come to the school. I was in third year at the time, and she came for treatment. And within 5 treatments, her pain went away. She got stronger. We gave her exercise. My teacher gave her herbs as well. The whole treatment was fantastic. She avoided surgery. And not only that, but listen to what happened in the end. She loved it so much. And she was so fascinated about how excited I was every time we talked about TCM after that 2 years after I finished school, she decided to go back to school herself and did the acupuncture program. That was so cool. I love to hear so many people that are in our profession that have used TCM or acupuncture in the past, and it kind of led them to go and study it and help other people. So to me, this is always such a positive story. All right, so let's start looking at carpal tunnel syndrome. So first of all, what is carpal tunnel syndrome? It basically arises from the median nerve compression, often due to repetitive strain, like my girlfriend as a librarian. Symptoms include tingling and numbness in the hand area resulting from inflammation and pressure in the wrist area because the nerve is completely compressed. Now, the common symptoms are going to be, like I said, numbness, tingling. Then the grip is going to get weaker where we can't even open a jar. We can't open a door. It becomes weaker and weaker. The pain is usually worse at night. We have different patterns we're going to look at, but most of the time the pain was going to be worse at night. And also, carpal tunnel syndrome patients may have tendency to drop objects because they're so weak, right? There's a sensation of weakness. But it always starts with really strong pain before it leads to the numbness and tingling. And we're going to look at what does that look like in TCM pattern in a moment. Now, the causes, as we said, are repetitive movement. I have to tell you, I have a lot of hair on my head. It's very thick and it's quite long. So when my hairdresser has to dry my hair after she cut it and dyes the roots that are so turning gray, hello. But, I feel for her because she's going to dry my hair with the hair dryer and repeat the same movement with her wrist over and over and over. And I'm always thinking, oh my gosh, is she going to get wrist pain? So hairdresser is one of them. The other one we see a lot is cashier at a grocery store, for example, when they have to scan over and over, and it's always the same hand that they scan with. A lot of them wear a wrist brace. Now, another one that's surprising is if you treat pregnant women, I treat a lot of pregnant women, we get a lot of carpal tunnel syndrome during pregnancy, and not because of repetitive movement specifically, but because there's a lack of blood. So if the woman is anemic or has blood deficiency to start with, when she becomes pregnant and there's less blood, this is why most women will take iron supplement, then often we're going to have carpal tunnel syndrome. It's not going to happen until the second trimester and the third one, not at the beginning. It'll take a bit more time, but that's very common. And we with acupuncture can truly help because women during pregnancy can't take a lot of medication, right? Makes sense? Those are the most common cause we see in practice. Now, when we look at the wrist, the channel involved, we always want to look at the channel, right? Channel theory is really important. So the primary channel involved in carpal tunnel syndrome are pericardium, the heart, the lung, so all three yin channel on the anterior side of the wrist, but also the large intestine and the sanjiao. The reason why the small intestine, which is the last one on the wrist area, is not involved is because the median nerve affects mostly the thumb, the index, and the middle finger. It can go all the way to the ring finger, halfway through the ring finger, but that's it. It does not involve the pinky or the fifth finger, so the small intestine is not necessarily involved in it. The heart, however, is crossing the palm, and because there is a lot of hand pain as well, then it is involved in carpal tunnel. So basically, the three yin hand meridian are involved, and then two in the back, which is sanjiao and large intestine. So those are the 5 meridian involved. So when we do local point, we should use the points that are involving those 5 channels. Each channel will present unique symptoms associated with the median nerve compression and blockage. The pericardium, lung, and heart are going to have more palm pain and wrist pain, of course. The large intestine is going to have more thumb pain, right, specifically, and the sanjiao is going to have more pain in the back of the hand, but also involving the middle and fourth finger more. I don't know if you use the tan balance method, but if you do, this is a perfect disorder to use it for because it's so good for pain. Not just for pain, but it is really good for pain. By the way, if you haven't taken the Tan Balance Acupuncture course that is given by Dr. Sonia Tan, a really dear friend of mine who's such a good teacher, I'll have the link for you below because this is such a popular course. We have level 1 and level 2 at AcuPro Academy and people absolutely love it. It will be a game changer for your practice, specifically when it comes to pain. So I just wanted to give you a little bit of hand-ankle pairing. If you don't know the Tan balance method, let me tell you, it's kind of holographic. It's the opposite side of the body and the opposite limb of the body. So because we have hand and wrist issue, we are going to needle the opposite ankle area. If the pericardium channel is involved at the wrist, it is at the center of the wrist, right? So we are going to pair it with the channel that's at the center of the ankle, which is the stomach. So stomach 41 would be a great point. If large intestine is more involved, so let's say around large intestine 5, you could use the liver channel at the ankle with liver 4. If it's more of a sanjiao issue, which is on the posterior, on the back of the wrist or the hand, then we could use spleen 5 as the ankle opposite side point. And then if it was more of a long issue, like around long 7 or long 9, then we can use the bladder channel, which is bladder 60 at the ankle. Does that make sense? So if you don't know the Tan balance, I know this feels a little bit overwhelming, but if you do, you know exactly what I mean. So this is a very good way to needle when you can't needle the wrist or when you don't want to because the person is in a lot of pain and you wanted to use the balance method. You can get really relief right away immediately with the Tan balance method. So I absolutely love it. Now let's look at the main TCM patterns that are affected in carpal tunnel syndrome. We always want to treat the branch, which are the symptoms, the pain at the wrist area, obviously, but we also want to treat the root, which is the TCM pattern. This is how I love how Chinese medicine works, because we cannot just treat the symptoms. We have to figure out the root, which is the TCM pattern. The 3 main patterns are Qi and blood stagnation, which shows up first because it shows up with sharp pain, and that's usually how it starts. And of course, it's impact the overall health and vitality of the person because they are in a lot of pain. The second one that often shows up is wind damp, which obviously damp will cause blockage because it's sticky, right? And wind will show as moving pain, meaning that sometimes the pain will be more on the anterior part and the palm. Sometimes it goes more on the posterior part and maybe at the wrist area. It'll move a little bit. So that's a wind damp, but it's going to feel heavy. The dampness is going to show as heavy symptoms. And then the last one, that's a long-term one or pregnancy one, like we said at the beginning, is more of a liver blood deficiency. We're starting to have a lack of blood, which results in fatigue, weakness, so we can't open a jar, we can't even open a door, and so it's affecting the strength of the hand. Let's start with Qi and blood stagnation. Like I said, it's severe fixed wrist pain that is going to be worse at night. If it's a woman, there's going to be a lot of PMS, maybe some clots in the blood or dysmenorrhea. There's going to be a purple tongue and a choppy, wiry pulse. But really, the key here is a severe pain at the wrist. Now, when it comes to herbal formula, one of the best formula is Shangtong Juyutong, which is really good to help moving blood. However, acupuncture rocks when it is time to use it for moving blood. So we could start with Ba Xie. Ba Xie are extra points. They're a group of points. There are 8 of them because Ba means 8, and they are located in between the web of each finger. So of course we have 4 web on each side, and that makes it 8 points. We're going to have to do this no matter what the pattern is. Those are going to be your local points that we're going to use specifically for any pattern affecting carpal tunnel syndrome. Then, of course, because it's Qi and blood stagnation, we're going to do large intestine 4 and liver 3 to open the gate, move Qi, move blood, relieve the pain. We can also do Sanjiao 4 at the wrist area, pericardium 7 because it also clears heat and moves blood. Spleen 10 is the same way, so we could do spleen 10 as a distal point. Now, as a distal point, I could also add stomach 36 to help the healing process, and you could also add up gallbladder 34 because it's the influential point of sinews, tendons, ligaments, and joints. So I would do this as a distal point as well. The second pattern is wind damp. Now, the wrist pain is going to come and go. That's the wind, right? It moves a lot. So it's not always going to be there. And then it's going to move. It's going to migrate up to the arm, maybe to the extensors on the arm. It's going to migrate maybe to the fingers and change as it goes. But there's going to be heavy hands and fingers and maybe some numbness. And it's going to be worse on rainy days and worse on cold and rainy days. So Vancouver, hello, this is what we get here because we get a lot of cold and a lot of dampness. So the tongue's going to be pale with a greasy coat because the person is probably starting to be blood deficient and they're on their way to blood deficiency. The pulse will be wiry, maybe slippery. This is hard to know at this stage. And if pulse is not your strength, don't worry too much about it. Look at the symptoms when it comes to carpal tunnel syndrome. For a formula, we have a formula called Fan Fan Tong, which is really good for wind and dampness. But again, acupuncture is going to be your best bet here. So we want to do the Ba Xie extra point, still do pericardium 7, Sanjiao 4, large intestine 4, right? And then we are going to clean up the dampness with spleen 9. We can do small intestine 3 if we feel like the pain is radiating all the way up the arm. We can also add up extensors point like large intestine 10, right? We can add up more points, gallbladder 34 for the sinews, tendons, ligaments. We can also add up stomach 36 for healing process. You always have to think this is just a guide. You have to adapt with each patient. Have you signed up to my free weekly newsletter yet? I share exclusive content I don't share anywhere else. So if you are not on it, I have the link for you below. It's completely free and you are absolutely going to benefit. Every week I share tips and tricks you are going to love, including case study. The link is for you below. The last one is blood deficiency. So blood deficiency is going to be when this person is having carpal tunnel for quite a long time or she is pregnant. The main symptoms are going to be tingling, numbness, pins and needles in the fingers, worse at night as well. The person's going to have pale face, pale lips, pale nails, pale tongue. They're going to have bad vision at night, so night vision, that's not really good. Maybe floaters, maybe seeing spots. That's, again, a liver blood deficiency, right? And maybe some dizziness. But technically, when we look at the blood deficiency for carpal tunnel, we want to focus on that tingling, numbness, weakness in the wrist. So it's not super painful. It's just no strength, right? So that's what we're looking at. And then the pulse will be thin, probably choppy, and the tongue would be pale. One of the formula that's great for this is Sewutong. Sewutong moves blood and nourishes blood. So it's a great formula. However, again, it'd be great to have acupuncture. We're starting with Bashier, the group of points in between the finger web. We're back to pericardium 7, which is still your local point every single time. Then large intestine 4, of course. We can add up stomach 36 because it's great to nourish blood and nourish qi. We could add up spleen 6 because it does that as well. We can add up spleen 10. We could do back shoe point, bladder 17, back shoe point of blood, bladder 20 for spleen because spleen produces blood, bladder 18 for liver because liver stores blood and liver is in charge of qi moving to bring blood to the extremities. So that's what you can use. However, you can also look at not using the back shoe point if you don't want to and just doing a lot of front treatment and doing stomach 36, gallbladder 34, spleen 6, always follow what you think is best for your patient. Let's continue with other techniques we use that I love. First of all, ear acupuncture. When it comes to ear acupuncture, putting ear seeds for the patient to acupressure at home is fantastic. And of course, we can acupuncture the ear while the patient is on the treatment table. But I don't want to overdo it for the patient. I'm not one of those that wants to put a lot of needles. I'd rather put the least amount of needles and put the seeds for patients to go home and have the little homework. So when it comes to carpal tunnel syndrome, of course, we're going to do the wrist area. You can do the hand area. You can do the arm area. But usually wrist and hand is probably enough. So put the wrist on one side and the hand on the other side. Other techniques we can use is obviously cupping and moxa. Now, if we're doing cupping, we use very small cups, and we can do it along the pericardium channel and the large intestine channel, specifically at the forearm where the extensors are located to try to move qi and blood. And we can do moxa. And if we're doing moxa, we can do it on the Bashier point, on pericardium 7, large intestine 5. We could use a moxa stick to warm up the whole area, specifically if there's wind, damp, and cold obstruction or invasion, right? So if it's really heavy and it's swollen or it feels better with heat. Because a lot of our patients that have carpal tunnel syndrome, it is part of their job and they don't want to quit their job and they're not going to quit their job, we have to do preventative measures. One of them is supplement. So vitamin B6 is really good for nerve function. So it really helps reduce pain. And we can get B6 from salmon, from chicken, from bananas. The next one is omega-3 fatty acids, which is great as an anti-inflammatory and for nerve health as well. We can have supplement as fish oil, or we can have salmon and fatty fish like sardines or halibut. I love halibut. It's one of my favorite fish, although salmon's pretty good too. Magnesium is a great mineral to relax the muscle and to reduce inflammation. And we can get magnesium from a lot of sources as well, like almonds, spinach, nuts, and seeds, or take it as a supplement. And if we're taking supplement for muscle relaxation, glycinate is the best one to take, not citrate, because that's more for constipation. Turmeric. I love turmeric. Turmeric is anti-inflammatory. It's great to protect the nerve. And we can take it as a supplement. Yes, you can cook with turmeric, but taking it as a supplement is fantastic. If you haven't listened to my podcast on turmeric. I had a guest, Dr. Shivani, who did a PhD on turmeric. That's amazing. I love that podcast because I learned so much about the ability and the benefit turmeric has, and that has been proven. So she is such a wealth of knowledge. If you haven't listened to that podcast, I'll have the link for you below because I think it was fantastic. Vitamin E can be added up as well to reduce inflammation or as an antioxidant. And the food that contain vitamin E are sunflower seeds and almonds. So nuts and seeds are great in that instance. Also ALA or alpha lipoic acid, which is great to protect the nerve as well. Again, preventative. And capsaicin is a supplement that comes from pepper, so very, very strong, spicy kind of, very hot, but it's really good for pain release as a topical cream. So this is more the Western side of it. We can also do a topical cream using cinnamon, ginger, and turmeric. That's something that I learned in TCM school, and you can put it directly on the wrist and warm it up, or you can use a heat lamp. It's fantastic. Turmeric is very staining, so we have to really be careful when we use it on the wrist because it's going to stain the clothes that are around the wrist, so we want to be aware of that as well. Have you got your copy of my third book, Chinese Medicine Treatment Made Easy, yet? It covers TCM treatment protocols for over 160 syndromes, including carpal tunnel syndrome as well. You have a choice between the digital version, which comes with a lot of video links to complement it, or the hard copy, which ships all over the world from the publisher. What are you waiting for? Get your copy today. The link is below for you, or go to acupureacademy.com and click the shop tab on the menu bar. Now, we also want to recommend patients lifestyle tips for wrist health and, like I said earlier, preventative if it's part of their job and they can't quit their job. It's really important to stretch the wrist daily, but even like every half an hour at the desk, specifically to do extension and flexion of the wrist. I would say extension is probably the most important one because we are always in the same position. So stretching the arms above the head, doing a lot of stretch to open the chest as well because we're all going to be hunched forward. That's how it goes for most people. Obviously, ergonomic setup would be ideal. Having elbows at 90 degrees on the desk, wrist neutral, so a mouse that has ergonometric support is really important. We want to avoid cold exposure on the wrist, so it's really important to keep it warm. Manage stress, because stress makes everything worse, specifically because liver is in charge of moving qi, and qi moves blood, and so if we're stressed, there's no circulation of qi, and so that creates more issue, right? So that's important as well. And we want to show patients to massage their wrists, specifically the pericardium, long channel area, gently every evening and keep it warm. Those are preventative measures we can educate our patients on. Let's recap the main points. We want to look at the channel involved. We want to treat the root pattern and the branch can be directly at the wrist area with the symptoms or using the tan balance method as well. We want to add up other technique like cupping, moxa, ear acupuncture. We want to educate the patients on what they can do for preventative measures, and we can recommend supplements if that's something you like to do. If you don't have to. I'm giving you the whole perspective. You can take what you feel resonates with you because I really truly hope it benefits you and in turn your patient. My goal with all the content I share is to help you and support you as a practitioner or student, so in turn, you can help your patient. I'm so grateful for your continuing support. Don't ever forget, you are a TCM rockstar. Watch this video next. Have a fantastic day and keep rocking it using acupuncture.